Okay, everyone, this is week 3. You've already had Professor Wettendorf's review that happened last night. He put that up on the news feed for you. He's also done a little review on asthma, I believe, and is intending to continue with doing some reviews on COPD. I'm just going to go over a few things. I'm going to hide my face where we can see the whole screen here. I do want to say just keep up the good work and make sure you're staying on track, but I want to go over a few things with your syllabus, and then we're going to jump into some ENT stuff, including guidelines for acute otitis media and otitis externa, and just a few other pearls that I think that you should be aware of going forward. Make sure that you're staying current on your readings. This is getting into some really important material that you're going to use very, very frequently. Okay, so going over your syllabus, you're going to see the Module 3 and what the reading is. There are a lot of different guidelines here. Some of them are going to be over your pediatric guidelines, and some are going to be the adult book finally. There's also the book that covers both, this Hollier, I'm not for sure how you pronounce her name. But if you look on that, this book will cover a lot of the information that you're wanting to see. There is a quiz again at the end of the week. It's going to be important that you not wait till the last minute to finish the quiz. There's also a DXR clinician on Martin that covers the fever and sore throat. You do have a practice attempt on the DXR clinician. Make sure that you're doing that practice attempt. You want to have every opportunity to do the best that you can on these materials. If you wait until the last minute and you have any kind of computer malfunction or anything like that, there's limited things that we're going to be able to do as an instructor, because you do have time during the week to work on this, so waiting till the last minute is not an excuse to not get it done. Okay, so I want to go over really quickly the DXR grading rubric. You have this available on D2L as well, and you need to look at how the grading is taking place. We are not requiring the SOAP note. That's been reviewed with y'all already. It's been on newsfeed. I know people still had questions about it for some reason, but we're not making you do the SOAP note on there, because on your CDMs there's going to be it's basically just a souped up SOAP note. We talked about that before. There's an example on there. Make sure you're already looking at that material and familiarizing yourself where you don't get overwhelmed with those CDMs. So on the DXR scoring categories, you need to make sure that you're looking at clinical reasoning, physical examination, your content knowledge, and medical management. Those are the main things to being able to score well. There's not a specific numerical value that we're looking at as far as overall on those DXR clinician. They scored a little bit differently than we will, but you need to be hitting on these key areas and making sure that you're examining the things that are particular for that patient. Some of these scenarios don't have near as detailed an exam required to be able to come up with a diagnosis, and others will require extensive examination and testing. So just make sure that you're doing all of that. If you've done it on your practice attempt, we're not evaluating that, so you need to repeat all of that on your final attempt. If you only go to your final attempt to do a diagnosis, then you're not going to get full scoring on that. Okay, going back to your evaluations for your class, you'll notice that your DXR clinicians are worth 20% of your grade, and your CDMs are another 20%. So that's a big component of your grades, to make sure those are done accurately and on time. Your quizzes are only worth 10%, but those quizzes are going to give you information for the rest of the class and will help you on your studying for your examinations. We're not going to release the quiz questions for you to review. You can make note as you're going through kind of what that's pertaining to. The exact quiz questions will not be on your examination, but it will point out some key areas that we think you should be focusing on in your reading. You also have the midterm and final, and then you have your discussion boards and all of your preceptor and clinical affiliation agreements. So start working towards those goals. Make sure on your midterm and final that you're making a determination on how you're doing that. The final is going to have to be Proctor U. That midterm, you have a ability to take the test at the campus, as we previously discussed. Now going on to covering otitis externa and otitis media. When you're dealing with otitis externa, make sure that you understand that that's a infection of the external auditory canal. You usually have some exquisite pain with manipulation on the outside of the ear, or you have itching. Those are usually caused by some kind of fluid exposure in the ear. That's the reason it's referred to as a swimmer's ear at time. Prevention strategies are avoiding exposure to warm, humid conditions. Make sure you dry your ears after showering or swimming. Don't place foreign objects in the external auditory canal, including cotton swabs and paper clips and toothpicks and whatever else you can come up with to put in your ear. Make sure that you do treat your ear infections aggressively. So if you're getting an external ear infection, you need to come in and be started on some kind of antibiotic drops. You may have to use an ear wick if the external auditory canal is swollen shut. An ear wick is just a little piece of cotton that will facilitate passage of the medicines into the ear canal and make sure that it's being delivered to the parts that's affected the most. One of the options for people, especially people that get repetitive external ear infections, is to have a 2% acetic acid and water mixture that they put a few drops in their ear after swimming or after showering. It's a 50-50 solution. As far as treatment choices for that, there's a lot of different antibiotic drops and things available. One of the keys to remember on otitis externa is that you can't use some of the ear drops if ear tubes are in place. If they do have ear tubes, then you want to make sure that we're using only ciprofloxacin. There are others that contain certain drops or certain hydrocortisone or other steroids that can be bad. You can use Ciprodex, which has dexamethasone in it, and you can be safe with that. Okay, quickly moving on to otitis media. There are different categories to that. You have acute and you have chronic otitis media. You also have serous otitis media. Serous otitis media usually points to like allergies or some kind of viral infection, and treating that with an antibiotic is not going to do any good. An acute otitis media, there's lots of different changes to guidelines. It is currently believed that most people will recover from otitis media without treatment with antibiotics. However, if somebody is in exquisite pain or has significantly bulging tympanic membranes, then treating with an antibiotic is not contraindicated. Antibiotics do not remove pain or improve symptoms within the first 24 hours, so it's really important that we treat these patients with Tylenol and Motrin and maybe localized heat to the external ear. That does help some with the symptom control. First-line treatment for otitis media is going to be oral antibiotic therapy. Ear drops have limited, if any, impact on otitis media. So the frontline treatment is going to be some kind of penicillin-based antibiotic, amoxicillin. Depending on if they have other symptoms, you can also use an augmentin on them. You can also use some cephalosporins if there's some reason you can't use an amoxicillin or if they're resistant to an amoxicillin. Now, I want you to be familiar with a lot of different components of ENT, and I'm not going to cover all of them. I'm just going to cover some of the main ones. So I want to go over some life-threatening situations that you need to be on alert for. One of those is epiglottitis. It can be life-threatening. It's usually caused by flu, strep, staph, or some kind of virus. When you see this in practice, you're going to see that fever is the first symptom. They're also going to report some sore throat. They're going to have anxiety because they just aren't able to get that air in. You're also going to see lymphadenopathy, beefy red pharynx, drooling, muffled voice. It's kind of like a hot potato voice. They may have some shortness of breath and inspiratory stridor. If that's happening, you need to make sure that you're maintaining their airway and getting them to the hospital. Another example of a hospital emergency would be a peritonsillar abscess. When you're dealing with a peritonsillar abscess, you usually have somebody that's had pharyngitis or tonsillitis recently, and it's just a complication of that. The gold standard treatment is a needle aspiration, which you're not going to do in your office setting. You're going to send them to the hospital or to an ENT if they can get into an ENT. I've had some local success with them handling this outpatient. It's usually an inability to swallow. They'll be drooling. They need an incision and drainage, just like you would typically with any other abscess. The complication is the location of this abscess does risk the airway becoming obstructed, so they need to be transported to the hospital with oxygen on. The only other thing that I really want to touch on with ENT is the presence of a parotitis or mumps. We've had actually some mumps cases at my clinic in Wichita Falls recently. Over the last 6 months, I think I've had a total of 5 come through. 3 of them did test positive. The other 2 were cash pay patients and elected not to be tested but were symptomatic. So it's something that I want you to keep in mind. The mumps obviously is a virus that we can't do much for, but it is becoming more prevalent in practice. When I talked to my ER doctor, Dr. Blomquist, who y'all all had the pleasure of meeting, he says he's never actually seen one in practice, so he refers to me, unfortunately, as his mumps expert, which is not something I really look to become an expert in. But since it is becoming more prevalent, it's even happening with a lot of people that had their immunizations. I happen to be one of the unfortunate people that the immunization does not work with, and I can't develop titers against the mumps. Even with that exposure with these patients, I did not receive them or catch the mumps, so I'm not for sure how accurate all that information is. I want you to be sure that you're reading all the materials for ENT. Keep in mind that Professor Mack and I are not technological geniuses, so we are learning how to use these video functions, and hopefully it is of some benefit to you. We're all readily available to you. I think you've noticed by now that we're getting back to you within 24 to 48 hours on your emails, sometimes much quicker than that. We're trying to make sure we're getting your responses that agree with one another. We want there to be some uniform responses across the different sections for this course. If you have any other problems or concerns, make sure you get in touch with us. Make sure you're reading your syllabus and that you're up to date on all of the calendar requirements and everything. We don't want you to get to the end of this and have mismanaged your time. If you need anything else, let us know. Thank you very much.